For checking the cells, you know that this is the very dim light and this is a bright light. So you need to have it on the very bright light. The other thing that you need to look at is the width of the beam and how big is the beam width and length. So I usually tend to do it very small, and then with the beam. So this is it. And then you need to have very high magnification. So now it's on 1 magnification, so you put it 1.6. Okay, and then you go to the anterior chamber. So the flare and the cells usually are tricky to pick up on the slit lamp unless you do it or see it for more than 1-2 times. So once you see it once, then you will be fine. That, you know, when you open the projector, and all the light comes, this is how you see the cells in the anterior chamber. They're just going everywhere.
A bit like the dust in the projector.
Exactly.
Love it, thank you.
So I'll just, so this is the needle. Just put it this way. And then green light. I think you need to concentrate on the green light because sometimes it shows that it's red, so it means that you're not on the right distance from the patient. Okay, and then you go to the other eye. Perfect, that's all. Just look up, please. So we ask the patient to look up. We put 1 drop here, and then we ask the patient to look up. 1 drop here. And then what I do, I mix the drops. Okay. 1 drop of fluorescein. You mix it with epoxy. Should not come from the way. Okay, I'm sorry. Okay, so before checking the pressure, I always check the eye to see how is the eye. Just my routine in examining my patients. After cleaning the slit down, I ask the patient to put their chin down and forehead to the bar, so the eye should be at this level. Okay. And then narrow beam, examine the eye. Okay, so we start with the cornea. The cornea looks very clean. The anterior chamber, the lens, all looks good. And then move to the other eye. Cornea is clean and clear, anterior chamber and the lens. And then take this little prism. So there is a line here. The line should be at the same level with here. So the way to put it, we have little thing here. This way. Okay. And then this is the blue light. It says blue. 90 degrees. Shine the blue light. We hold the eyelids but we don't press. And we rotate from here. So this is the pressure. Okay. Once we see the half circles getting in contact from the inner side, then this is the right pressure. Okay, and then we move to the other eye. And when we move to the other eye, we just move also the Goldman. And then I hold the eyelids. Okay. We don't really push so hard. So this is the pressure. Okay, and this is when we see the two prisms. Not sure whether you can see it here on the camera. Okay, do you want me to? Here you go, that's it. Perfect. Yep, and sit back please. And all done.
Don't worry, it's all ready. So the black thing comes off like that.
So that you save the black thing, you don't throw that
Yeah,
in.
you keep this end. Each one of these packs comes with a black end at the top here.
Oh, okay,
Yeah.
okay.
So if you've lost one, then you look there. And if you can't find any, then...
And the straight bit has to sit at the top.
Yeah, so you look for this... Yeah, put it on. I think I just feel it with my finger. I'm trying to think what I do.
You just, okay, just clicks in there.
Yeah.
And it
okay.
looks flat on that end, okay.
Good stuff, okay. So then, pull that back, the whole thing. That's it. And then it's slightly off at an angle, actually. I'll just show you the first time. So it's slightly off, because you're trying to get
That into there.
this little bit here into there. So start in front, and then slide it on like that.
Oh, it doesn't sit right in the middle?
No, it doesn't.
Oh.
Try that again.
Okay.
So it sits slightly,
Slightly
off.
Yeah.
Okay.
Ah.
Which is your mixed one, this one?
That one, yeah.
Just one spot of this, yeah?
Yeah, yeah. Or a couple if you're feeling nice.
Put your chin on lens there.
Rubbish, keep on acting.
So does sting a little bit, obviously, if you, as you know.
Do you have that in it? Sorry, all over your face, you don't mind, do you? I think went in actually.
No.
Lean away from her.
Something out there.
Okay, so you need to have the brightest possible light.
Okay.
You need to be on the blue filter, which it already is on.
Do I use this piece as well?
So that just stays slightly to the side.
Okay, so
It
literally
doesn't matter
just
exactly
using
what
this.
angle, but yeah. Just a little bit less, yeah. So brightest possible, we make that as wide as it can be. Good. That's as bright as it can be. Good. So remember, his eye's numb, so it doesn't matter too much.
I can smell. You okay?
Fine.
So
Did you ever get the patient to hold their own eyelid, or
no.
do you prefer it's easy
Yeah,
to
I
do
do it
yourself?
myself.
Oh,
Yeah.
I see. There's like two circles.
Yeah. So when you touch
My
the
hand is in the way. What's the whole
yeah, so I use my right hand for the left eye and vice versa. Actually, that's it. Keep looking straight ahead at the machine. That's it.
Okay. So I'm touching. I know I'm touching because I can see the.
2 circles. Okay, so now
But it's not. It's. I've still got two circles that aren't really touching.
yeah, so now you need to move this bit
Okay.
until it changes.
So
So
I need another arm.
let go. That's it. You don't need to touch his lid anymore. Move that until the 2 circles are just off each other.
Oh, I wasn't in the centre. No.
So sometimes, if you press for a bit, okay, it's just like, you can like come out again, and just wipe the tip like that. So you want 2 nice smooth circles. Sometimes it gets
So
all
I can
smudged.
see this.
Yeah, so that's good. Yeah, like this, you mean?
Yeah.
So you want to move it that until they're just touching like that.
Okay.
Yeah.
Oh. Oh.
So go withdraw a little bit. Come back a little bit.
So the two, I can see 2 fluorescent circles, and one of them met the outside.
Okay.
But there.
Right. Well, his pressure's not 62.
Hope not.
So what's happening now with the little circle?
They're moving away again.
Okay, let's have a look. Just see.
Yeah.
So, so that wasn't straight, the flat bit, that was on the side.
Okay.
And then, close your eyes for me. You need to make sure the eyes are really nice and dry, because when they blink, it makes the circles go really big and smudged, and then you don't get an accurate reading. So you want nice small circles, like that. So his pressure's about 10.
Oh,
Have a
I
go.
see. It looks like you've got it right.
So you're just gently touching the cornea. You don't want to be sort of piling into the cornea. You just gently touch the surface.
When you say the cornea.
Yeah. What's that?
Well, no, not what's that, but
Yeah, all right.
like it looks like it's just going straight for the pupil.
Oh, there,
Well,
yes.
Yeah. So practice moving the thing around. So the cornea is the front window of the eye. That's
Yeah.
transparent. The pupil's behind it.
So you're literally just going straight.
You're just gently touching the surface of the cornea. We're not going into the eye or anything.
Okay.
I can't make it go back to exactly how you had it.
But just
I
the
saw it.
centre, middle of the eye.
Yeah, middle of the cornea, centre of the eye. Yeah, you can aim
Okay.
for the pupil, but you just want to gently touch
Cool,
it.
it's gonna
Okay.
get
You
really
want,
difficult to do.
you want thin circles. As soon as they're a bit thick and smudged, start again. Dry the eye, dry the tip.
So I saw two like that.
Yes,
That's right.
good. So
like that?
2 circles. You want them just the two ends to be touching,
Like a sine wave.
like an S on its.
How does that work? What is it doing in that thing to make that?
So there's two prisms which are on top of each other, and they bend the light differently. And
Okay.
when the top prism's touching, it's making the light into one semicircle like that, and then when the bottom one's touching, it's doing it in the other direction.
This was one. This was each notch is 2, 4, 6.
So the pressure is 6. So what do you say is when you get to the 1?
It's what? 10.